Good day, everyone. I am Yna Denolan, a BSN 1B student, and for today, I will be assessing the head, face, and neck. So, prior for today's assessment, all the materials needed should be complete and organized, and we will wash our hands before and after this assessment. So now I am done washing my hands. I have now my face mask on. And here are the main materials needed for the head, face, and neck assessment. So here we have our gloves. We will be using our gloves in inspecting and assessing the head, especially in inspecting for masses and skin infections or alopecia in the hair. And we have here also our cup of water that will be used in the thyroid assessment and the movement of the thyroid. And we have here our stethoscope that will be used in listening for brute sounds in the thyroid assessment. So now I will be donning my gloves and I will start with the assessment. So now we will start the assessment, but first we will provide privacy to the patient and we will introduce ourselves and this procedure for them to have their consent in assessing their head, face, and neck. So good morning, sir. I am Yna Denolan, your nurse for today. So what's your name, sir? So good morning, Sir Jobin. So for today, I will be performing the assessment of your head, face, and neck. And this way, we can see if there are any abnormalities like manifestations of alopecia, hair baldness, or if there are any masses, indentions, or pain even if it's present when I'm palpating or touching your head, face, and neck. Are you okay to participate in this assessment?
Yes.
So, okay. Thank you. So, we will start in inspecting the head. We will inspect the head for the size, shape, and symmetry. So, can you properly... Yes, thank you. So, here, we will inspect the size. The size is normal and is proportional to the body. So the shape also of the client or patient's face is round, it's normal, and it is also symmetrical. So we can see here that there is no drooping on any side, which can be a manifestation of Bell's palsy. So we will now inspect for the face. So we will have to see the appearance here. It is normal. We will check if there is symmetry of facial features. Here are the brows, the eyes, the nose, and the lips of the patient, the client, and it is normal. It is symmetrical. And we will inspect or check for any lesions. There are lesions here, no. So there are no lesions present. It is normal. So we also check for hair distribution. So it is also normal. And we will check for the movement. And this way we will be checking the cranial nerve 7 or the facial nerve. Can you close your eyes? Can you open it? Can you smile for me? Can you frown? Can you puff your cheeks? So as you can see, he did that with ease. So we can see that the cranial 7 is intact. We'll now palpate for the tenderness of the head and also feel if there are any masses. So here, there are no indentions also. There are no masses present. And it is normal. We will also check if there are any lice infestations. I can see none, and we will also check for manifestations of alopecia if there is any spots or baldness present. So I can also see none of it. It is normal. So next, I will palpate the face for tenderness and masses. So in palpating the face for tenderness and masses, I will be discarding now my gloves in the receptacle bin. So we will palpate for the tenderness and masses. If there are any signs of pain also. So dili ra sakit. Dili ra dire sakit. So it is normal. So now we will palpate for the temporomandibular joint, which is here for mastication also. We will palpate it with our 2 fingers bilaterally. Can you open your mouth? Okay, close it. So it is normal. And there are no clicking or any abnormalities that I have felt or heard. So it is normal. So now we will proceed in assessing the neck. So here I will give you a cup of water and I will see if you can swallow normally. So here. Inom og gamayng tubig. Thank you. Okay. So he can swallow. So can you sit upright more? Again. Okay. Yeah, again, we inspect in neutral position. So take a sip. Okay. Inspect in hyperextended position. So ano na. So can you sip another water langga? Okay. So it is normal. So now we will palpate the neck. So here, thank you. We will palpate using light palpation. Dili ra sakit. We will also check if there are any tenderness or masses. Can feel nga wala. None. There is none. Dili ra sakit. So there is also no pain detected. And now we will palpate for the cervical nodes. So we identify the nodes while palpating them. So we will lightly palpate the occipital nodes at the base of the skull here. Dili ra sakit, no pain. Okay, none. So we lightly palpate the post-auricle nodes behind the ears here. Bilateral but also. Dili ra sakit. Okay, none. Normal. We also palpate the preauricle nodes in front of the ears here. Dili ra sakit. Okay. So now we will also gently palpate the tonsillar nodes at the angle of the jaw here. Dili ra sakit. Lightly palpate the submandibular nodes under the mandible here. Dili ra sakit. And lightly palpate the submental nodes under the tip of the chin. Dili ra sakit. Okay. So in this manner, we will lightly palpate the superficial cervical nodes at the upper portion of the sternocleidomastoid muscle. So here. Dili ra sakit. Okay. And we lightly palpate for the posterior cervical node behind the sternocleidomastoid muscle. Dili ra sakit? Okay. And we deeply palpate the deep cervical nodes at the sternocleidomastoid muscle here. Dili ra sakit? Okay. And now we lightly palpate the supraclavicular nodes above the clavicle here. Dili ra sakit? Okay. And we lightly palpate the infraclavicular nodes below the clavicle. Di ra sakit? Okay, so it is normal. We can also check for the range of motion of the neck if it's normal. So, can you look down your chin here? Can you look up for me? Okay, can you go sideways? Other side? Back. So, the range of motion of the neck is normal also. Now, I will be palpating the thyroid gland using posterior or anterior approach. So first, I will locate the thyroid gland just below the cricoid cartilage here. You can feel it. Dili ra sakit? Okay. And the anterior approach, we will slide fingers to the right, palette to the right lobe here. Dili ra sakit? Okay. Can you? Okay. Dili ra sakit? Gently displace the trachea to the right. Dili ra sakit? Displace na nato. Gimove. Move or displace the trachea. Dili ra sakit? So, can you face the camera? Can you swallow for me? Okay. So, we will palpate the right lobe of the gland. Okay. Di ra sakit? Okay. And we will be using, again, the anterior approach. Vice versa to the left side now. So, slide fingers to the left. Upload. Di ra sakit? Okay. Gently displace the trachea or move the trachea. Di ra sakit? Sakit. And again, can you swallow? Face the camera. Can you swallow? Okay, normal. And we will palpate the left lobe of the gland, the thyroid gland. Dili ra sakit? Okay. So now we are done. And we'll be using the posterior approach in palpating the thyroid gland. So with the head, we will first start to tilt the head to the right side. So can we tilt it here, langga, sir? Okay, to the right lobe. We tilt the client's head to the right and palpate to the right lobe. Gently slide the fingers to the right. Dili ra sakit? Okay. Can you swallow? Swallow. Okay. Swallowing is normal. So now we will use it vice versa also to the left side now. So we will tilt the head. Palpate the left lobe. Dili ra sakit? Okay. We gently slide our fingers to the left. Can you swallow? Okay. Again, can you swallow? Okay. So, auscultate the thyroid gland and by using the stethoscope, the bell of the stethoscope, and listening for any brute sounds. A brute sound is a continuous sound heard in the thyroid gland. Can you hold your breath? Okay. Thank you. thyroid gland is not enlarged and there are no brute sounds present. So, in using the bell of the stethoscope. So, thank you, sir. We are now done with the assessment. So, thank you so much. So, after this assessment, I will be washing my hands. That is all for today. Thank you and Godspeed.